In today's video, we're going to answer the question, is a Medicare supplement plan worth it? So yeah, we're going to answer that question, not to confuse a Medicare supplement plan with a Medicare Advantage plan, okay? It's totally different. Like we said, we're going to focus on a Medicare supplement plan, also known as a Medigap plan. Before we could explain or even begin to say, well, is it worth it or not? We need to understand why we need a Medicare supplement plan in the first place. So let's start out with, what is Original Medicare? Original Medicare is for health insurance for individuals 65 and older who worked in the U.S. and paid Medicare taxes at least 10 years, at least 40 quarters, or you became disabled, you had a qualifying disability, you received SSDI, and got Medicare automatically after 24 months, okay? So you either got Medicare from being 65 and older, or you became disabled. Medicare is actually health insurance that you earn from your working credits. Remember, I said you have to at least have 40 working credits, worked in the US for at least 10 years paying Medicare taxes, okay? So Medicare has two parts. There's Medicare Part A, which is your hospital coverage, and you also have Medicare Part B, which is your medical coverage. And within the two, you have health insurance, okay? Now with Medicare Part A, usually it's zero monthly premium. Why is that? It's because you paid into this. This is what you was paying when you was paying Medicare taxes, okay? Now with Medicare Part B, it's actually based on the IRMA chart. And this chart basically shows you what you would pay for Medicare Part B based on your income. Most individuals would pay under $200 for Medicare Part B. You can also get your Medicare Part B paid for by Medicaid if you are a low-income senior, okay? Now, Medicare covers 80%, leaving you behind 20%. Believe it or not, the 20% has no cap, there's no ceiling, meaning there's no max out of pocket. But the Medicare supplement plan will pay the 20%. So that's why you want to at least have a Medicare supplement or a Medicare Advantage plan. But like we said in today's video, we're going to just primarily focus on a Medicare supplement. So let's dive right into this question. Is a Medicare supplement plan worth it? Let's get to it. So we're going to start out with pros, and then we're going to go into the cons, so that way you can answer the question for yourself, is a Medicare supplement plan worth it? And I'll help you answer that question as well at the end of today's video. So let's start with the pros. Pro number one is you want to be protected from that 20%. The Medicare supplement plan is going to be more predictable when it comes to your healthcare costs, because Original Medicare does not have a ceiling, does not have a max out of pocket. But when you have a Medicare supplement plan, it covers the 20%, now give you 100% of coverage. So the first pro is that you have predictable costs. So you have predictable costs when it comes to your medical overall costs. You know that the supplement will pay for the 20%, because Medicare, unfortunately, like I said, don't have a max out of pocket. 20% is 20% of anything. It could be 20% of a $1 million hospital bill, and you don't want that 20% bill. The next pro is that you can see any provider that takes Original Medicare. Yes, that is correct. When it comes to a Medicare supplement plan, there is no doctor network. There's no HMO to worry about or a PPO. This is national coverage within the US. So the second pro is that you can see any doctor that is accepting new patients that also accepts Medicare assignment. So as long as your doctor takes Original Medicare, they will also take your Medicare supplement plan. The next pro is you can travel with a Medicare supplement plan. And a lot of clients love this benefit. You could be in New York for 6 months, you could be in Florida. It does not matter, long as you're within the US, Puerto Rico, Hawaii, and the supplement will follow and pay the 20%. Another pro is for an individual that has high medical expenses. So if you see the doctor often, if you have frequent labs that needs to be done, if you have a chronic condition that requires a lot more attention, then a Medicare supplement plan will be the perfect match for you. So that is definitely another pro, that you don't have to worry about extensive medical debt when you have a Medicare supplement plan. Another pro is peace of mind. 100% of peace of mind when it comes to your medical bills and such. Think about it. No doctor networks, no prior authorization needed. You don't have to worry about the cost. All you have to do is worry about your monthly premium. This peace of mind allows you to choose doctors that is right for you. You don't have to worry about being stuck within a network. So the Medicare supplement definitely gives you peace of mind, the peace of mind to not worry about medical debt, the peace of mind to travel within the US and not have to worry about doctor networks. So overall, peace of mind for sure when it comes to a Medicare supplement plan. So as long as you pay your monthly premium for your Medicare supplement plan, you don't have to worry about medical debt at all. And it cannot discontinue your insurance once you get sick or unhealthy or have a chronic condition. This is true peace of mind. Long as you make your monthly premiums, you are good to go. Another pro is no worry about prior authorization or pre-authorization. You don't have to ask your insurance company permission to cover a treatment, a test, or a lab. As long as original Medicare covers that treatment, that procedure, the supplement will follow and pay the 20%. So you don't have to worry about fighting with the health insurance company to pay your bill. So yes, no pre or prior authorization needed with a Medicare supplement plan. Another pro is definitely looking at your health history, your family history, and such. So this is how it goes with a Medicare supplement. When you first turn 65 or when you first enroll in Medicare Part B, you are eligible to get on a Medicare supplement plan without any health questions, without any underwriting, okay? So if you get sick down the line or anything like that, you are safe when you have a Medicare supplement plan. So it's very important to look at your health history, like I said, your family health history, to make that determination if a Medicare supplement plan will be the best option. Because remember, you can go to any provider that accepts original Medicare, okay? We cannot predict the future, but we definitely could look back at our family health and decide, hey, you know what? A Medicare supplement will be better off for me in the long run. So it's very important to look at your health and family health history as well. Alrighty, so now let's talk about the cons of having a Medicare supplement plan. The first con is underwriting, okay? Unfortunately, after 6 months of being eligible for Medicare or Medicare Part B, you do have to go through underwriting to get on a Medicare supplement plan. If you have a Medicare supplement plan and you want to switch to another company, you may also have to go through underwriting as well to switch your plan. So that is one of the cons, is that you may not be able to switch your plan if you have to answer underwriting questions and you say yes to any of these questions, then you will most likely be denied, unfortunately. Let's talk about some examples of underwriting questions. Some of the questions may ask you, do you have Parkinson's? Do you have dementia? Do you have diabetes with complications? Do you have AFib? Do you have chronic heart conditions and such? So yeah, that is definitely a con when it comes to underwriting. I know I've spoken to a lot of clients that is confused with underwriting with a Medicare supplement plan, because with the marketplace insurance, underwriting is not an issue, right? A company cannot deny you because of your health with marketplace, but that is not the case with Medicare, okay? Not the case with a Medicare supplement, I should say. There is underwriting involved when it comes to a Medicare supplement plan, so that is definitely a con. Now, let's talk about the second con when it comes to having a Medicare supplement plan, and this is that the supplement will only follow what original Medicare does. So if Medicare does not cover a service, then the Medicare supplement would not cover that service, such as extra benefits such as dental, vision, hearing, and such. If you want dental, vision, and hearing, then you need a separate standalone policy for dental, vision, and hearing. Unfortunately, Medicare does not see dental as a medical need and eyeglasses and such as a medical need. So you have to get a separate policy to have access to those benefits. So that is definitely another con. Another con is that Medicare supplement plans do not include drug coverage, okay? Now, if you're getting a medication at your doctor's office, like an injection or IV, that is covered under Medicare Part B. Now, when it comes to a medication that is prescribed by your physician that you take at home, this is not covered under a Medicare supplement plan. So you would need to enroll in a separate standalone drug plan as well. Depending on the medications you take, you would choose a plan that best fits your needs and will help pay for those medications as best as that plan, right? So the medications have to be in the plan's formulary for it to be covered. So that's why it's very important to work with a broker that understands the market, understand the plans and the area, such as our office would be more than happy to assist you. But yeah, a prescription drug plan is not included in Medicare supplements, so you would need to enroll in a standalone drug plan, which is Medicare Part D. And yes, you do have to enroll in a drug plan even if you're not taking any medications. And if you choose not to enroll in a drug plan, which I do not recommend that, when you do get on a drug plan, you will be penalized for not enrolling in a drug plan on time. So once you are eligible for Medicare Part B, you have 63 days to enroll in a prescription drug plan. So please do not forget that step. You definitely want to go ahead and enroll in a drug plan, even if you're not taking medications. Alrighty, so now let's talk about our last con. The last con is if you cannot afford a Medicare supplement plan, then of course that's going to be a con. I always tell my clients this: look at your budget now and for the remaining of your life. If you could afford the Medicare supplement now and plan increases year after year, then a supplement plan can be the perfect match. There's so many great reasons why a Medicare supplement plan can be a great option for your situation. But of course, we had to add the cost as a con because some individuals simply cannot afford a Medicare supplement. Now let's talk about Medicare Supplement Plan G versus Medicare Supplement Plan N, okay? So a Medicare Supplement Plan G is very comprehensive. The only thing that is not included in a Medicare Supplement Plan G is your annual deductible, okay? So it's usually under $300 for the year. So you have to pay your deductible before the supplement plan will kick in. So let me give you an example. So if you go to the doctor in January and his bill is $150, you will actually pay that $150 until you meet the deductible. Once you reach your deductible, then the supplement will kick in and pay the 20% of the bill for the remaining of the year, and the deductible will actually reset the next year, okay? So like I said, a Medicare Supplement Plan G is very comprehensive. After your deductible, it takes care of the rest. Now let's talk about a Medicare Supplement Plan N very similar to G. However, Supplement Plan N has something called excess charges, meaning that the doctor can charge up to 15% more than original Medicare. So if your doctor charges you these excess charges, you need to pay that addition to what Medicare pays, okay? So that's that. Also, there are co-pays with Plan N, up to $50 for an ER visit and up to $20 for a doctor visit. So that's the difference. Now with a Plan N, the monthly premium will be lower than a Plan G, usually around $30 or so less, because you have copays with a Plan N. So that's the difference from Plan G and Plan N, and these are the most popular supplement plans, okay? So that is that with Plan G versus Plan N. Okay, so if you're watching this video and you're like, well, what is the alternative? The alternative would be a Medicare Advantage plan, okay? So if you cannot afford a Medicare supplement, then I would recommend a Medicare Advantage. The Medicare Advantage works a little different. It doesn't cover the 20% you have share of costs, meaning that you will have copays as well. So the health insurance company will pay its portion and you will pay your portion. You don't have a monthly premium usually. Usually there's no monthly premium, but like I said, you do pay copays. You still pay your Medicare Part B premium, but usually for the Medicare Advantage plan itself, there is usually not a premium, and it comes with extra benefits such as dental, vision, hearing, and your prescription drug coverage as well. So that is an alternative if you cannot afford a Medicare supplement plan. So let's go back and answer this simple question. Is a Medicare supplement plan worth it? And the answer is yes. There is so many pros when it comes to a Medicare supplement plan. The pros definitely outweigh the cons. So yes, a Medicare supplement plan is worth it. Thank you so much for watching today's video. I hope you enjoyed this video. If you know anyone that needs this information, please share this video. If you have any questions, comments, leave them in the comment section below, and I'd be more than happy to answer your question. If you need assistance with any of this information, give our office a call. We'd be more than happy to assist you. Thank you so much for watching. Please like this video if you like it. Give it a thumbs up. Subscribe to see me again, and I'll see you on the next video. Thank you so much for watching. Bye.